Well, we've kept you company this Ramadan, and today being my final day on the iftar drive, and I must say it's been an absolute pleasure, and particularly looking at the segment Voices from Palestine, and it's been a wonderful segment put together with the assistance of the Palestine Solidarity Alliance, and bringing you these voices from Palestine, covering various angles of what is taking place in Palestine, the genocide. We've looked at it from a media perspective. We've looked at it from an activism perspective. We looked at Israel Apartheid Week. There's just so much that we've actually discussed both locally and with guests from overseas. And tonight we're going to end off our segment in our series with distinguished medical expert, Dr. Ghassan Abu-Sittah. We're talking about genocide, medicine, and survival. He is a distinguished medical expert and also dedicated his career to improving healthcare standards and accessibility. He has a deep understanding of the unique challenges faced by the healthcare sector in the Middle East. He can provide insightful advice, guidance as well. Multi-award winning aesthetic and reconstructive plastic surgeon with globally recognized expertise in trauma and conflict-related surgery. And this, we know, is taking place with the genocide that is unfolding in Gaza. And we've seen it in the past. We've had people like Dr. Mens Gilbert, who came over to South Africa as a guest of Salam Media. He spoke about the health sector, the collapse, and we've covered this over the last 18 months. Dr. Ghassan Abu-Sittah, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome. Yes, wonderful you're able to join us. And, Alhamdulillah, just looking at your track record, Alhamdulillah, very, very impressive. And Alhamdulillah, you are truly blessed. And also the wonderful work that you are actually doing in the healthcare sector. Perhaps you could just share some of that with us, Dr. Abu-Sittah.
So at the moment, I'm in Beirut and we have two parallel projects. The first one is we are continuing to bring the wounded children from Gaza to Beirut for treatment. And we have 17, and we're in the process of arranging for some of the kids that were evacuated during the ceasefire to Beirut for treatment. And the second track is the 1,400 Lebanese children who were wounded in the war and in the continuing Israeli air raids since the ceasefire came to effect. So Israel has continued to bomb Lebanon since the ceasefire. And in total, we have around 1,400 to 1,500 children who are wounded. And we're currently working on a project with UNICEF to provide reconstructive surgery for these children. So these two tracks are happening at the same time. Inshallah, we are going to be able to provide these kids with the kind of reconstructive surgery, mental health support, and rehabilitation that they much need.
Well, inshallah, we hope so. And really, when one looks at just the task that lies ahead from a medical perspective to heal those who have been wounded and not only wounded, we're talking of serious conditions and serious cases that we are talking about. And I'm sure, Doctor, it presents a lot of challenges, and I'm sure some very, very serious challenges. And just to understand some of these key challenges faced in the Middle East, but specifically in Palestine, what would those be?
So we have around 100,000 who have been wounded by the genocidal war. The majority of them have not been able to receive the kind of surgeries that they need. We have probably, and we still don't know the exact figures, between 6,000 and 11,000 amputees, of whom probably 4,000 are children who have not received their prosthetics because Israel prevents the entry of the equipment and the material needed and the staff needed. We have a completely destroyed health system, which means that the kind of surgeries that these people need, the system can barely provide. And now the system has gone back, whatever is left of it, has gone back to the treatment of the fresh wounded as Israel continues to bomb Gaza and bomb people in the tents that they're in. over the last 2 weeks since they broke the ceasefire. And so neither the wounded from the before the ceasefire nor the currently wounded have available to them a health system that's able to help them.
Yes. Also, I think, what is very important to understand, Dr. Hassan, and we actually found this out when I talked to someone a psychologist in offering psychiatric treatment, and saying that one can never ever be prepared for something like this from a psychological perspective, and also in terms of providing psychiatric care where it comes to a genocide, when it's trauma and conflict related on such a mass scale. One can never ever be prepared. And I'm sure in your field as well, as a reconstructive plastic surgeon as well, with all your experience, with whatever at the end of the day, but just because of the sheer magnitude of the trauma and the conflict related surgeries, it does present huge, massive, massive challenges, and one can never ever be 100% prepared.
Absolutely. I mean, I had over 20 years experience as a war surgeon before this genocide, before I went to Gaza on the 9th of October 2023. And I keep telling people it's the difference between a flood and a tsunami. These other wars were just like a flood, and Gaza's like a tsunami. For two reasons. One, the sheer scale of the killing, the butchering, the wounding, the maiming, the targeting of civilians on such a massive genocidal scale. And two, that the destruction of the health system, the targeting of health institutions and health workers is a central part of the Israeli military doctrine during this war. And so you feel in the health system, in the hospital, you are in the middle of the battlefield, because you are, for the Israelis, the battlefield that they want to fight this war in.
Yes, certainly. Now, let's just talk about the healthcare sector and being a key target by both the United States of America and by Israel in terms of preventing, in terms of cutting aid, in terms of these healthcare services that have been targeted over a period of time. And not only facilities, we're talking about service providers, we're talking about human capital, we're talking about personnel, we're talking about doctors, both in Gaza and also in the occupied West Bank.
Absolutely. Israel, as part of the systematic destruction of the health system, killed over 1,200 health workers, imprisoned around 450, of whom 160 remain in Israeli prisons, and refused to release them when there was a ceasefire. And this is not by chance. These people were targeted for whom they are. Your chance of being targeted, killed, or wounded by the Israelis during this war, if you were a doctor or a nurse, was 2.5 times that of any other specialty, of any other profession. And so wiping out the whole generation of health workers was a critical component of that destruction, which is a genocidal destruction that aims to make Gaza uninhabitable, aims to make Gaza a place where the wounded die of manageable wounds, the chronically ill die of neglect of these illnesses that become medical emergencies, and those who are forced into these overcrowded, cramped centers for internally displaced with no no running water or sewage, die of infectious diseases. These genocidal killing machines that are in addition to the bombs and the missiles is the reason why the medical journal, The Lancet, estimates that Israel has killed 290,000 Palestinians in Gaza, of whom only 65,000 were killed by traumatic injury, and the rest killed as a result of the destruction of the lived environment. And 290,000 is 14% of Gaza's population. At the end of the 5 years of the Second World War, France had only lost 4% of its population. So it shows you the magnitude of this slaughter and this killing machine that Israel had set up with the help of the West, with the help of the United States, with the help of the United Kingdom and Germany and France and Holland and the NATO government and the collusion of the Arab world.
Well, certainly, and as you said, as a collusion of the Arab world as well. And once again, when we talk about this killing machine, and the other day, I spoke to a journalist out of Al Jazeera, and we were paying tribute to the journalists that had fallen, the 208 journalists that have been killed. And I'm sure, paying tribute to the fallen medical healthcare workers, from the specialists to the doctors to nurses to the ambulance drivers, anyone who has provided some sort of medical service to the throughout this last 18 months during this genocide as well. And we need to recognize it. We need to pay tribute to them. We need to pay tribute to their bravery as well. We've seen cases of some of the foreign doctors who rendered some service in Gaza. When they came back, we've heard about them. We've heard their reports in terms of what they've seen, and they speak about the Samud, and they talk about how the people of Gaza and how just working in the healthcare system in Gaza had actually strengthened them in more ways than one, including their faith.
Absolutely. The degree of ihtisab that we find in people there, the degree of iman, that this is God's will and that they will resist and persevere and stay in Palestine is a humbling experience. You are left in awe of the Palestinians in Gaza, the degree of steadfastness, the degree of their insistence on remaining in their homeland, and their ihtisab to everything that has befallen. And it is mind-numbing, the kind of loss and grief of children, of siblings, of parents, of relatives, whole families wiped out. And that kind of iman has kept them going. I believe that it's the only thing that has kept people going during the 17 months of genocide.
Certainly. Now, Doc, also looking at the medical sector in the West, and I just like to get some sort of an idea as to how they've been responding or even possibly organizing in raising awareness of the duplicity of the West and the atrocities committed by Israel. What is the medical sector globally doing in this regard?
So there are two medical sectors. We see individual doctors, nurses from across the globe, some of whom had never been politically involved, so outraged, feeling that their humanity is under attack, and really supporting in every way, either coming out in the streets of London or Paris or in the States, or volunteering to work in Gaza. And then we see the medical establishment, the British Medical Association or the American Medical Associations or the Royal College, that are complicit in this genocide by becoming part of the genocide enablement apparatus that exists and operates in the West, which includes the media, includes the universities, includes all of the institutions of power in the West. And so this dichotomy between the individuals, the people who look at their children and see in their children the children of Gaza, see their shared humanity with the Palestinians, and those institutions of power that have harnessed all of their influence to serve the Israeli agenda of genocide, to ensure that the genocide is protected so that it can continue with its final solution.
Certainly. And just finally, Doctor, I'd just like to explore the possibilities of mobilizing medical boycott, of apartheid Israel in the West. I know in South Africa, there was an event that had taken place, and one of the specialists obviously came from Israel, and I know there were huge protests that had taken place. He came in as a guest speaker as well. It's events like these, obviously, and I know we've got what we call healthcare workers for Palestine here in South Africa, which is a movement that has been set up, and I'm sure there are similar movements that have been set up across other many other countries around the world. And let's just talk about mobilizing this medical boycott of apartheid Israel in the West.
People need to understand that at the beginning of the war, in October, 150 Israeli doctors signed a petition for whom they paid money to have it advertised in the daily newspapers, calling on the Israeli army to attack Shifa Hospital. We have had reports from our Palestinian colleagues who had been imprisoned by the Israelis that Israeli nurses and doctors took part in their torture and in their beatings. And we have heard testimonies from Palestinian prisoners who had been released, who had had amputations performed against their will by Israeli doctors. The complicity of the Israeli medical institution and medical establishment in this genocidal war, the almost unanimous support that all aspects and all strata of Israeli society, including the health institutions and the health profession, in support of this genocidal war, means that it is critical that there's a boycott of Israeli health professionals, Israeli health institutions, in terms of research, in terms of cooperation, in terms of visits. It is an affront to not just the victims of the genocide in Palestine, but the victims of apartheid in Israel, in South Africa, that an Israeli medical doctor is invited to South Africa. This is not just an insult to us, but to the thousands and hundreds of thousands of victims of apartheid in South Africa, to those who gave their lives so that the South African people are free, that such an individual is then invited to South Africa. The other issue that we want to highlight is not just the boycott. Health Workers for Palestine in the UK has started a fund to support the families of the Palestinian health workers who were targeted and killed by Israel. Because these health workers who gave their lives for their patients and for their people have left their families destitute and completely unsupported. And so we've set up a fund for that group so that we can get money to those families who've been left without a breadwinner.
Yes, Dr. Ghassan, in fact, it's been fascinating actually having this discussion with you. And this is the last of our series that we've been having during the month of Ramadan in terms of Voices from Palestine. And I must say, it's been an absolute pleasure actually ending off this entire series we've had during the month of Ramadan with someone like yourself. And we do appreciate you taking time out for us this afternoon right here on Salam Media. But I'm sure at some point in time, we will be connecting, we will be touching base again, because there's just so much more to discuss. There's so much more to unpack over a period of time, because we know this genocide hasn't gone away. It's not going to go away soon. And there's still going to be many, many challenges that actually lie ahead. But for now, we thank you. We appreciate your time. And whatever is left of the month of Ramadan, we continue making dua as well, for your peace, for your blessings as well, and also you being rewarded for the wonderful work and the effort that you are actually doing as well, both in the medical sector and also the welfare and the well-being of the people of Palestine, inshallah.
Thank you very much, and Eid Mubarak to you and to all of your listeners. And as we say in Palestine, Al-Eid Yawma Na'ud. Eid is the day we return to Palestine.
Inshallah, we certainly will. And let's hope we will return in our lifetime. And we'd like to be there when you return and we return. And inshallah, we all will return together, inshallah. We're looking forward to the day. Eid Sa'id to you as well. And Eid Mubarak. Assalamu alaikum wa rahmatullahi wa barakatuh. Dr. Ghassan Abu-Sittah joining us, and really a fantastic, really a wonderful, wonderful interview that we've had with Dr. Ghassan, and which actually marks the end, sadly, of the series that we've had together with the Palestine Solidarity Alliance. And we must thank them. We need to thank Nazim as well, and also everyone, the executive of the Palestine Solidarity Alliance. I know Sister Firoza Mayet has been very, very active as well in putting it together the entire list of guests that we've had as well, Hassan Lorgat too as well. So to the PSA, once again, we'd like to say Jazakallah. We'd like to thank you for partnering with us during this month of Ramadan for this particular segment, Palestine Radio, Voices from Palestine. It's been extremely, informative, but also at the same time, it's heart-wrenching sometimes, but the struggle still continues, and we will continue. It doesn't end with the month of Ramadan. The struggle of for Palestine will continue, inshallah, and we look forward to all of that after the month of Ramadan. I look forward to your company, inshallah, after the month of Ramadan as well, because this is my last edition of the Iftar Drive with you right here on Salam Media. So it's my pleasure now. It's the Asar Azan, and thereafter, Maulana Yunus Kawanga will take you through to the time of Iftar in Johannesburg. For myself and the team, fi amanillah, Allah accept all your efforts, Allah accept your du'as, Allah accept your Ramadan. Let us continue making dua for each other. Let us continue making dua for all those who are suffering right throughout the entire world, and our brothers and sisters out in Palestine. Assalamu alaikum wa rahmatullahi wa barakatuh.